This is Devon, an average girl with an average life. But much like other people who go into the forest, she did not know that she was about to contract Lyme disease. The tick latches onto its victim, inserting its barbed mouthpiece along with a cement-like substance to anchor itself to its victim before it starts feeding. The tick then exudes an anticoagulant to prevent the blood from clotting, along with small amounts of saliva that contain anesthetics to prevent Devon from taking any notice. But the spit also holds the bacterium that is in fact Lyme disease. After hours of waving its legs in search of a warm body, the tick has found its host. As Devon walks home, oblivious to the giant tick on her leg, it hurriedly crawls up to the perfect spot on her leg to hide and to feed. Now that the tick has started to feed, the Lyme disease bacteria, Borrelia burgdorferi, steps up to the plate. It has been lying wait in the stomach of the tick, but gets ready for action when it senses its cue, the blood. The bacteria changes its outside disguise to OSPC so as not to be traced. It makes its way to the mouth of the tick and travels to the site of the bite. Still undetected, the tick continues to feed, and the bacteria travels into the bloodstream. The tick has a cloaking agent of its own, and Devon still does not know the tick is there. The spiral-shaped bacteria gets noticed by the body. The antibodies come for it, but is prepared for this setback. Before the antibodies can destroy it, the baby bacteria begins to cloak itself, changing its outside appearance and curling up into indestructible balls, undetectable by even the most experienced antibody. The bacteria has reached its target, Lyme disease, beginning its reign. Devon has been feeling very tired and sore lately, but she passed those symptoms of Lyme disease off as average fatigue and muscle pains a teenager will have. Devon has spotted the engorged deer tick feeding behind her knee.
What's that?
She is starting to experience more severe flu-like symptoms, like extreme aches and pains, headache, and fatigue. She's starting to wonder if the tick may be connected to what she thinks is the flu.
Good evening, ma'am.
Doctor, there's an insect on my leg.
Let me take a look. Actually, what you have there is an arachnid. What you have there is a deer tick, and the only way to remove it is to grab it by the mouthpiece and remove it from your leg. Ah! And now we have to kill it with alcohol.
Alcohol?
Ha 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 ha!
Notice the age of the tick. Not yet fully matured, Devon was bitten by a nymphal tick, the perfect infector, Lyme disease. Since larval ticks have not yet had the glory of their first blood meal, they cannot infect Devon, but the nymphal tick is the next best vampire. Its small size allows it to hide on Devon's skin undetected, and it can pass on the disease more stealthily than an adult tick. Although an adult tick could also pass on the disease, many adult ticks take their last blood meal on the deers where they mate. The best infector is the one that was pulled off of Devon, the dreaded nymphal tick.
Now what we have to look for is Lyme disease. Some common symptoms to look for are lack of energy, headaches, stiff neck, fever, and also chills and joint pain. Sometimes Lyme disease can even cause confusion.
Pardon?
Since you're experiencing many of the symptoms common associated with Lyme disease, I'm going to do an ELISA test on you. Well, your ELISA test came back negative, so that's good news.
Yay!
Devon may go home happy and carefree, but we know this won't last long. Although Devon was given an ELISA test that came back negative, there is a big chance that she could still have Lyme disease. ELISA looks for antibodies, but it's not right all of the time. She's probably fine, though, as long as she doesn't get a bullseye rash. Devon, now free of Lyme disease, can live out her life healthy and more aware. To prevent you from getting Lyme disease, you could wear longer, lighter colored clothes to cover your skin, wear bug repellent, or apply bug-eliminating chemicals to your clothes, and check yourself and your family pets for ticks.